Hello everyone, I am Dr. Nikunj Mittal, Senior Consultant Neurosurgery from Dharamshila Narayana. Today I am going to talk about trauma. These are the questions asked commonly from our viewers to us about the traumatic events. The first question was, what should a person do when he has a trauma or she has a trauma? Trauma, whether a roadside small accident or a big accident, should be given a first aid immediately, should be taken to the local hospital or a big hospital nearby and get a first aid and seen by a doctor when there are pain in the head, hands, legs or on the face. Second question was, what are the signs and symptoms of a trauma? Whenever somebody has trauma or accident, if the patient has continuous headache, vomiting, blurring of vision, unconsciousness, blood from the ear, nose, throat, he should immediately go to a doctor or the nearby emergency and show in the hospital for further management, which is told by the doctor. The third question from the viewers, which we commonly hear, is what is the effect of trauma on the brain? Whenever a person has a trauma or accident which is very severe, the brain gets shooks. It is just like a jelly in the hard bone inside, so it shooks over and causes a lot of problems like hematoma or blood in the brain, for which you need to immediately go to the nearby hospital again and get a CAT scan done or an MRI. Sometimes after the trauma, when the patient is okay, then also they keep on having problems which we called as post-traumatic headaches, post-traumatic emotional traumatic problems like emotional changes, headache, body pains, for which you should not worry much, but definitely you need to keep a follow-up with your doctor, primary doctor, whom your treatment was going on regarding the trauma. Now, we have also received some queries. What are the different types of trauma and how they are treated? The trauma can be multiple types, like a head trauma, which we call head injury. It can be facial trauma, it can be limb trauma, it can be blunt trauma to the abdomen. So, whenever a patient suffers a trauma, that's why I told, go to the nearby emergency or the hospital and get yourself checked up. For each type of trauma, there is a treatment protocol and investigation protocol which the doctor tells, and the patient should get investigated for his benefit so that there is no catastrophe further later. Thank you.